Phlebotomy Certification Exam Review. Question 1. The standard urine value for protein is 1.005 to 1.030. Negative. 40 milliequivalent per 24 hours. Clear. Normal urine contains very little protein, so the standard result for protein on a urinalysis reagent strip is negative. Trace or positive protein, proteinuria, may indicate kidney damage, urinary tract infection, or other renal conditions requiring further evaluation. Question 2. The guaiac, fecal occult blood, test is commonly performed on what type of sample? Sputum, stool, throat swab, urine. The guaiac fecal occult blood test detects hidden blood in the stool, which may indicate gastrointestinal bleeding from polyps, ulcers, diverticulosis, or colorectal cancer. Patients must avoid red meat and certain vegetables for 3 days before testing to prevent false positive results. Question 3. If a small bore needle is used with a large volume tube to collect a blood sample, what will likely take place? Hemoconcentration. Hemolysis. Nothing. Hematoma formation. Using a small gauge needle with a large volume tube creates excessive vacuum pressure and turbulence, rupturing red blood cell membranes and causing hemolysis. The hemolyzed specimen will be rejected by the laboratory, requiring recollection. Question 4. The main venipuncture site is located in which of the following areas? The middle finger, the middle forearm, the dorsal side of the wrist, the antecubital area of the arm. The antecubital fossa, crease of the elbow, is the primary venipuncture site because it contains large, accessible veins, median cubital, cephalic, and basilic. These veins are well anchored, less painful, and located away from major nerves and arteries. Question 5. When transporting specimens from the patient unit down to the hospital laboratory, which of the following systems is used? Evacuated, courier, pneumatic tube, mail. Hospitals commonly use pneumatic tube systems to transport specimens quickly between departments. However, certain sensitive specimens, e.g., blood gases, cold agglutinins, may be affected by the pneumatic tube's acceleration forces and should be hand-delivered to prevent hemolysis. Question 6. Leaving tubes filled with blood in a rack without mixing will cause hemolysis, hemoconcentration, contamination, clotting. Tubes containing anticoagulants must be gently inverted immediately after collection to mix blood with the additive. Without proper mixing, blood will clot even in tubes containing anticoagulants because the additive remains concentrated in one area, rendering the specimen unusable. Question 7. Forcing syringe-drawn specimens into evacuated tubes will cause hemoconcentration, hemolysis, clotting, inaccurate mixing. Expelling blood from a syringe into an evacuated tube with force creates turbulence that damages red blood cell membranes, causing hemolysis. Blood should be transferred gently by allowing the vacuum of the tube to draw blood from the syringe, or by using a transfer device. Question 8. Exposure to light decreases concentrations in certain specimens that must be protected from light to prevent analytic errors. Which of the following needs to be protected from light? Ammonia, bilirubin, cytokines, potassium. Bilirubin is photosensitive and degrades rapidly when exposed to light, especially sunlight and fluorescent light. Specimens for bilirubin testing must be collected in amber-colored tubes or wrapped in aluminum foil immediately after collection to prevent falsely low results. Question 9. Residual urine is leakage of urine despite voluntary control. Urine collected over a 24-hour period. Urine remaining in the bladder after voiding. Urine that is normally voided. Residual urine is the volume of urine remaining in the bladder after complete voluntary voiding. Post-void residual measurement assesses bladder emptying function. Elevated residual, greater than 100 milliliters, may indicate bladder outlet obstruction or neurogenic bladder. Question 10. When should the specimen container for a blood sample be labeled? When the patient first arrives. Immediately prior to the blood draw. Immediately after the draw. When preparing the laboratory requisition. Specimen containers must be labeled immediately after blood collection while still in the presence of the patient to ensure accurate identification and prevent specimen mix-ups. Labeling away from the patient increases the risk of mislabeling errors, which can lead to serious patient safety incidents. Question 11. As the phlebotomist, you have just completed drawing the last blood sample tube. You place gauze over the puncture site, remove the needle from the arm, activate the needle safety device, and then release the tourniquet before applying pressure. Is this the correct sequence of steps? No, should have activated the safety device first. Yes, this is the correct sequence. Yes, but should release tourniquet before applying pressure. No, tourniquet should be released first. The correct sequence is, remove the last tube, release the tourniquet, place gauze over the site, remove the needle, activate the safety device, and apply pressure. Releasing the tourniquet first prevents continued venous pressure that could cause bleeding after needle withdrawal. Question 12. The phlebotomist would collect a blood sample in a tube containing the anticoagulant sodium citrate which inhibits glycolysis for which type of laboratory test? Electrolytes. Blood glucose. Ionized calcium. ESR, erythrocyte sedimentation rate. Sodium citrate is the anticoagulant in light blue top tubes used for ESR and coagulation studies. For ESR, sodium citrate preserves red blood cells in a liquid state without causing clotting. Glycolysis inhibition is the role of sodium fluoride found in gray top tubes, not sodium citrate. Question 13. What instrument may be used when trying to visualize the veins during venipuncture? Otoscope. Venoscope. Ophthalmoscope. Cytoscope. A venoscope, transilluminator, uses LED light to visualize veins subcutaneously by illuminating the tissue. It is particularly helpful for patients with difficult-to-find veins, such as those with obesity, dark skin, or edema, improving first-stick success rates and patient comfort. Question 14. To prevent glycolysis, which additive is used? Sodium fluoride. EDTA. Heparin. Sodium citrate. Sodium fluoride inhibits the enzyme enolase in the glycolysis pathway, preventing red blood cells from metabolizing glucose in collected specimens. Found in gray top tubes, fluoride is essential for accurate glucose and lactate testing. Without it, glucose levels can decrease 5 to 7% per hour at room temperature. Question 15. Which of the following would be the very first step in performing a routine venipuncture on a patient? Identify the patient. Identify yourself. Explain the procedure. Apply the tourniquet. Proper patient identification using at least 2 unique identifiers, e.g., full name and date of birth, is the first and most critical step in any blood collection procedure. This prevents specimen collection from the wrong patient, which could lead to misdiagnosis or transfusion errors. Question 16. Which of the following situations would most likely trigger hematoma formation? Removing the tourniquet before removing the needle. Filling the evacuated tube only half full. Removing the needle while the tourniquet is still on the arm. Applying too much pressure on the puncture site. Removing the needle while the tourniquet remains on the arm causes continued venous pressure that forces blood out of the puncture site before clotting can occur. The tourniquet should be released immediately after the last tube is filled, before needle withdrawal, to prevent this complication. Question 17. Following venipuncture, which of the following should be applied to the venipuncture site? A cotton ball. An ACE bandage. An alcohol wipe/pad. A clean sterile gauze pad. A clean sterile gauze pad should be applied directly to the venipuncture site after needle withdrawal, followed by firm pressure. Gauze is preferred over cotton balls because cotton fibers may adhere to the puncture site and cause irritation. Alcohol wipes should never be used as they cause stinging. Question 18. When is a phlebotomist allowed to perform a venipuncture on an ankle vein? Never. When a patient has IVs in both arms. During an emergency. When all other options are exhausted and physician has given approval. Ankle and foot veins are considered last resort venipuncture sites and should only be used with physician approval after all upper extremity options have been exhausted. These sites carry higher risks including thrombophlebitis, infection, and potential harm to patients with diabetes or peripheral vascular disease. Question 19. The primary reason for using a syringe transfer device is to safely transfer blood from a syringe into an ETS tube. Ensure the proper amount of blood can be supplied to the lab. Provide an easy method to separate packed cells from plasma. Reduce time required to get blood from syringe to evacuated tube. A syringe transfer device safely transfers blood from a syringe into evacuated tubes without needle stick risk. This eliminates the need to remove the needle from the syringe for transfer, which is a common cause of needle stick injuries, and also prevents hemolysis from forceful ejection. Question 20. Which of the following is of primary importance in preventing rolling veins during venipuncture? Tightly applying the tourniquet. Selecting the median cubital vein. Using a 23-gauge needle. Anchoring the vein while inserting the needle. Anchoring the vein by pulling the skin top below the puncture site stabilizes the vein and prevents it from rolling away from the needle tip. This technique is especially important for patients with loose skin or mobile veins, increasing first stick success rates and reducing patient discomfort.